Hey guys, it's Sarah here. In this video, I'm going to be going over fundamentals of nursing related to pharmacokinetics, terms, etc. So let's get started. Okay, so medication legal standards. So these are just rules related to medications. The first one that came out was the Pure Food and Drug Act. And this basically said that all medication has to be free from impure products. And then we have the FDA. The FDA stands for Food and Drug Administration. And this is basically like the policeman saying that they make sure that everything goes through testing, appropriate testing before being sold. And then each state and local has regulations, so that really varies by state. So now we go on to naming medication. We have your chemical name, generic name, and trade name. It's pretty simple. The chemical is what it's made of, the composition. For example, C8, and whatever. No one's going to ask you what exactly it is, but all you have to know is the chemical name is the composition of the medication. The generic name. Generic name is that when a medication first comes out, that company or manufacturer of that medication came up with it, so they're the ones with the generic name. Any other company could replicate it afterwards, after a certain period of it being in the market, and that would be the trade name. So the generic name is the first person that came up with that medication, and the trade name is whatever other company decides to open it up. Usually the trade name is much easier to pronounce because they're trying to, it's all about marketing. So, they're trying to get you to remember it. And the generic name is cheaper, know that. Generic name is cheaper. For example, acetaminophen is a generic name, Tylenol is a trade name. And over here we have another example in the picture. As you see, the brand name, which is also called a trade name, which is also called a proprietary name, is Benadryl, and generic name is diphenhydramine. Okay, now just other information about medication is that medication is classified by effects on the body system, by the symptoms they relieve, and by the desired effect. So for example, Tylenol is an antipyretic because it takes down a fever. And also know that medication comes in all different forms. It comes in topicals, liquids, solids. We have the video. If you want to check the previous video, it goes over all that. Okay, pharmacokinetics. What pharmacokinetics is, it's basically the movement of the drug throughout the body. How it gets in you, and then how it gets out you. So there are 4 processes I would know these. Absorption, how it gets in. Number 2, where it goes, so that's distribution. Number 3, metabolism, how is it being broken down? And number 4, how is it leaving? Excretion. So absorption, distribution, metabolism, and excretion. So now we're going to go into each one specifically. Absorption. So absorption is how it gets in. You could do it orally, it could be a topical. So there are certain factors that influence how it's going to be absorbed. Number 1, the route. If you put it in through an IV, it's going to be one of the fastest ways. If you put it in through the skin, a topical, it takes a while to get in. Number 2 is the blood flow. If there's not a lot of blood flow, it can't circulate as fast as someone else who does have good circulation. Number 3, the body surface area and lipid soluble. So lipid soluble is going to be absorbed quicker than fat soluble. Okay, now where does it go to? So it's supposed to go to tissues, organs, specific site of action, depending on the medication. It also depends on the circulation, the membrane permeability, is it harder for it to get through the membrane, and protein binding. Now we go on to metabolism. How is it being broken down? So what happens is that the drugs are transported to the liver. When you take something in orally, it goes straight to the liver. Then we have biotransformation. And what this is that the liver enzymes, they break down the medication. So it's kind of like a recycling plant. If it's good, then they keep it. If it's bad, they detoxify it, depending on what the medication is. Okay, and last but not least, we have excretion. So that is basically how does it leave the body? You have the kidneys, the liver, the bowel, the lungs. You exhale it out, the exocrine glands, sweating. It really depends on the medication, and everyone's different. Okay, now we have medication effects. So once you have the medication, let's say I take Tylenol to break my fever. So you have a therapeutic effect. Did it work? Do I still have a fever? Did it bring it down a little bit? So if it worked and you got what you wanted from the medication, that's called therapeutic effect. If you have an adverse reaction, it's something you didn't want. There are 3 types of adverse reaction. Number 1, you have a side effect. So a side effect is something you know it's a side effect, you know it could happen, but you don't want it. For example, with Tylenol, one of the side effects are liver toxicity. So if it affects your liver, that's a bad side effect that you have, but you knew it could happen because that's what happens from taking Tylenol. A different type of adverse effect that you don't want is a toxic effect. If you have too much in your bloodstream, you took too much, you took a too high dose, then it stays there, and then you have an adverse effect. Then you have a toxic effect. And last but not least is idiosyncratic effect. And that's basically an unusual reaction. So side effect is something you predict that's going to happen. You hope it doesn't, but it could happen. And idiosyncratic is something that is unusual. It doesn't occur to most patients. And that's all under adverse effects because you don't want any of those to happen. And then we have an allergic reaction, which is basically a hypersensitivity reaction. And then we have an interaction. So for example, 2 medications or even grapefruit juice could interact with something. And when something interacts, it could speed it up, it could cancel it, or it could slow down the other medication's effect. And here are just some terminology to know related to medication. Therapeutic range. The therapeutic range is the desirable what you want. It's the same basically thing as a therapeutic effect, except for it's basically talking about the blood. So when you draw their levels, it's exactly what you want. For instance, they're taking Synthroid for their thyroid. You redraw their levels and it's perfect. So that's the therapeutic range. Peak. So peak is the highest level of drug concentration in the blood. So when you take a drug, before it gets broken down and everything, there's different, it's not going to be like the same exact concentration in the blood. It's different before it's broken down, after it's broken down, 3 hours later, 5 hours later, it depends on the medication. So peak is going to be the highest level of drug concentration in the blood. And this is very important when you're talking about insulin specifically, because insulins could cause someone's blood sugar to go down. And so you want to watch out, like when's the peak, take the blood sugar like that. Trough is the opposite of peak. It's the lowest concentration in the bloodstream. And plateau is when someone loses the effect of the drug. So I'm going to give you an example of plateau. For example, you take this medication, you take Tylenol every day for your headache, it's working out fine, and then you all of a sudden take it and it has no effect on you. And this could happen when you're taking it for a while and it just plateaus. Your body just gets used to it and needs a higher amount or needs like a lower amount. It really depends on each person. And then we have the biological half-life, and what that is when the medication is lowered by half in that time. So here's some other information related to pharmacokinetics and medication. Is you always want to put a 0 before the decimal, never after. So for example, 0.9, but never do 9.0. Safe drug administration, went through that in the other video. You should know that pediatric dosing is based off weight. So it's not a standard dose for everybody, it's based off weight. You want to make sure that you're cautioned with abbreviations because those could be misinterpreted, leading to medication error. You want to report all medication error. Okay, here are types of orders. So when a doctor puts in an order, they could put in all different types. They could put a standing order. So that's basically your everyday medication, like give Synthroid every day, in the morning, 1 time, before breakfast, etc. That's your standing orders. Your single order is a one-time dose. So it's going to be, give one-time dose of morphine to this patient. Now means that you should give it as soon as possible. Stat means immediately. PRN means as needed. So for instance, I'll give you a PRN medication for pain every 4 hours. So that means that if a patient needs it and is complaining, you give it to them every 4 hours. But you're not going to go ahead and give it to them if they're not in pain. And prescriptions are for stuff out of, you're giving a prescription or electronically, it's out of the hospital. So that's it. Thank you for watching. Please subscribe and like, and stay tuned for the rest of the series. Bye.